Health care for all. 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 Health care for all.
As an educator, I would never deny students access to education, information, personal growth, and academic achievement. So I certainly believe that everyone has a right to health care administered by medical professionals, not by corporations.
Now, Patty, I understand you're going to be risking arrest today.
Yes.
So why are you doing that? Why? That's a pretty big step.
Because I think more attention needs to be drawn to the issue. I don't think people understand the importance of this issue, and whatever it takes to get the message out there, I'm willing to risk.
Anything else, Patty?
I can't think of anything else other than to say that I just lost my mother, who died with dignity and grace through the Medicare system. And so it does work, and I would like everyone to have access to adequate health care.
Dr. Margaret Flowers.
And what group are you with?
I'm the Congressional Fellow for Physicians for a National Health Program.
And why is it important for you to be here today?
Well, I'm standing up as kind of a last resort effort to try to get real health care reform in this country. I've been working for years now advocating for a publicly financed health system that's truly universal, and have gotten nowhere with that. We thought this year, having a Democratic president, a Democratic House and Senate, that we would actually have real health reform, but we're continuing to see is domination of health care in this country by private corporations like health insurance companies and pharmaceutical companies. And the result of that is that patients are not getting the care they need, people are dying, and we're spending too much money. Doctors are getting desperate because they can't get care for their patients, and we've got to change this.
Now, Dr. Flowers, I understand you're going to be risk being arrested today.
That is correct.
And that's a pretty serious step. Why are you doing that?
I'm doing that because what's happening here in this country is unacceptable and intolerable. We know what the solution is. Our politicians know what the solution is. Public health policy, health economic policy all dictate that the best way to provide health care to every person in this country is through a single publicly financed health system. And yet, despite our attempts to educate the legislators in D.C., what they've proposed as health care reform is no change and is not going to solve the problems. Over 120 people die every day in this country. We're the only country that has this situation of the industrialized nations, and they have a solution. It's to just improve and expand Medicare to every person. We can do it quickly and simply, but they refuse to do that because of the money that they receive from the industry. And we don't have a democracy anymore. It's not acting in the best interest of people. We've got to stop this and do something about it.
Anything else?
Yeah, I just wanted to say that many of the American people have been brainwashed into believing that they need health insurance. But we have so much evidence to show us that health insurance in this country is not protective when somebody gets sick. Health insurance companies operate to make a profit for their investors. They do that by charging high premiums, by avoiding people with health problems, and by restricting and denying care. So the American people have been misled. They don't understand that a national single-payer system would offer the most freedom of choice, the most control over your medical decisions, and save everybody money. And so people are acting against their own best interests, and we've got to get the word out and educate people now.
Give me your name first.
It's Eric Naumburg, Naumburg.
And I understand you're a physician.
I'm a pediatrician.
And why is it important for you to be here today?
Because our healthcare system is not providing the kind of healthcare that we need. People who are uninsured, which is a large number of people, about 46 million, are at much higher risk of death than the regular population. It's now estimated that about 45,000 people a year are dying unnecessarily because they don't have health insurance. And I think we've proven pretty conclusively that for-profit health insurance does not work.
Doctor, I understand from Mr. Zeese that you're going to be risking arrest today.
That's
right.
a
fairly significant step. Can you explain why you're willing to do that?
Well, I think this is. I think healthcare is a human right. It's a civil right, just like anti-discrimination and those kind of things. And it's a. Sorry, getting distracted. It's the. I think it's the civil rights movement of this decade, and that's the only way we're actually going to get care. I think is to show people the kind of care we need is to show people that it is a human right, it is a civil right, because the people in Washington don't respond to those. Right now, are only responding to money. They're responding to lobbyists from the private insurers, drug companies, the large private hospital chains. So we need to do something. Going down to Washington, talking to people has not been effective. Talking to legislators has not been effective.
Anything else, Doctor?
Just that I'm very disappointed that I just heard this morning that there was something called the Kucinich Amendment in the House Reform Bill, which would have enabled single-payer reform at the state level. And that, I gather, in the most recent bill has been removed as of this morning, and that's a big disappointment because we had hoped at least to get one state level reform, and that may still be possible, but it's going to be more difficult if that's not in the bill.
Okay. Thanks a lot, Doc.
Sure.
Single payer
Now you
now.
can give me your name, sir.
Single payer
Charles Loubert.
Single payer
Now, Charles,
Single payer
you're on the picket line here today at this demonstration, and I understand you're going to risk getting arrested.
Yes, I am.
Why?
Because people are dying, and my son, my oldest son, has no health care at all. Can't afford it, and he's not going to be able to get it.
And Kevin said you're 81 years young. Is that right?
Yes, I am 81.
So, and where are you from?
I'm from Baltimore. I live in Baltimore.
So you're concerned that people aren't getting covered, they're dying, and it's going to continue unless something really significant is done here.
And the government, it seems, and the Congress are suppressing any thought about Medicare for all. That everybody should be covered. Everybody should be covered in this country. It's a human right.
Medicare for all.
Anything else, Charles?
That I think will cover what I'm here for, and I do hope that it brings attention to so that people are aware of what's going on, aware that people are dying, aware that sometimes the care that's denied by insurance companies is a death sentence.
Okay, thanks, Charles.